Question number 1. Gossypiboma refers to options A. A benign tumor arising from adipose tissue. B. A retained surgical sponge left inside the body after an operation. C. A malignant tumor of the lymphatic system. D. A collection of pus within a tissue. The correct answer is option B. A retained surgical sponge left inside the body after an operation. Question number 2. Which of the following is a common complication of Gossypiboma? Options A. Pulmonary embolism. B. Intestinal obstruction or abscess formation. C. Bone fracture. D. Herniation of the incision site. Correct answer is option B. Intestinal obstruction or abscess formation. Question number 3. Which of the following is the most effective method to prevent Gossypiboma? Options A. Use of prophylactic antibiotics. B. Counting surgical instruments and a sponge before closure. C. Increasing operative time. D. Leaving wound open for drainage. Option B is the correct answer. Counting surgical instruments and sponges before closure. Question number 4. During a vaginal examination, the nurse identifies the fetal head as flexed with the occiput presenting first. This indicates which fetal presentation? Option A. Brow presentation. Option B. Face presentation. C. Vertex presentation. D. Breech presentation. Correct answer is option C. Vertex presentation. This is also called a cephalic occiput anterior presentation, easiest and safest fetal presentation for normal vaginal delivery. Question number 5. Which fetal position is considered most favorable for vaginal delivery? Options. Option A. Right occiput posterior ROP. B. Left occiput anterior LOA. C. Right mentum posterior RMP. D. Transverse lay. The correct answer is option B. Left occiput anterior LOA. In left occiput anterior position, the baby's head is down, that is cephalic or vertex presentation, and the back of the baby's head, that means the occiput, points towards the mother's front left side. In right occiput posterior or ROP, the baby is head down, but the back of the head faces the mother's back. In right mentum posterior or RMP, the baby's chin, that is mentum, faces the mother's back. Such positions are usually not favorable for vaginal delivery because the head is extended backward. In case of transverse lay, the baby lies sideways in the uterus, making vaginal delivery impossible unless the baby turns before labor or via cesarean section. Question number 6. A laboring woman fetus is in the occiput posterior position, that is OP position. Which nursing intervention is most appropriate to help relieve maternal back pain? Options. Option A. Place the woman in a supine position. Option B. Apply firm pressure or counter pressure to the lower back. Option C. Encourage the woman to lie still during contraction. Option D. Administer oxygen via mask at 10 liters per minute. The correct answer is option B. Apply firm pressure or counter pressure to the lower back. The reason is when the fetus is in the occiput posterior position, the baby's head presses against the mother's sacrum, often causing intense back pain during labor. Applying firm sacral counter pressure helps alleviate this discomfort by providing direct force to the area where pressure is most concentrated. This technique can be applied using the palm, fist, or a tennis ball during contractions. Question number 7. A nurse notes that the fetus is in a breech presentation at 38 weeks of gestation. What is the priority nursing action? The options. A. Prepare for emergency cesarean birth. B. Encourage the mother to ambulate frequently. C. Monitor fetal heart rate closely and report variable decelerations. D. Assist with episiotomy preparations. Correct answer is option C. Monitor fetal heart rate closely and report variable decelerations. At 38 weeks of gestation, a breech presentation means the fetus is positioned with the buttocks or feet first instead of head. This can increase the risk of umbilical cord compression, hypoxia, or prolapsed cord, particularly during labor and membrane rupture. Therefore, the Priority nursing action is continuous and close fetal heart rate monitoring to promptly detect any signs of fetal distress such as variable decelerations, which often indicate cord compression. Key nursing priorities are assess fetal well-being first through FHR monitoring, report variable deceleration immediately as they may signal cord compression or fetal distress, continue maternal observation and prepare for possible external cephalic version or cesarean section depending on the provider's plan and fetal status. Question number 8. A patient in labor is found to have a transverse lie. What is the nurse's priority action? Options: A. Encourage pushing during contractions. B. Prepare for immediate vaginal delivery. C. Notify the physician or midwife. Cesarean delivery is usually indicated. D. Position the client on her right side. The correct answer is option C. Notify the physician or midwife. Cesarean delivery is usually indicated. A transverse lie means the fetus is lying horizontally in the uterus with the long axis of the baby at a right angle to the mother's spine. In this position, vaginal delivery is impossible as neither the head nor the buttocks present first in the birth canal. Attempting to push or proceed with a vaginal birth could cause umbilical cord prolapse or uterine rupture, both of which are obstetrical emergencies. The priority nursing action when a transverse lie is discovered during labor is to: first one, immediately notify the physician or midwife because cesarean delivery is typically required for safe birth. Second one, the nurse should also avoid vaginal examination or encouraging pushing as these could increase the risk of membrane rupture and cord prolapse. Question number 9. During labor, a vaginal examination reveals a bro presentation. What is the priority nursing action? Options: A. Encourage ambulation to help descend. B. Prepare for possible cesarean delivery. C. Administer oxytocin to strengthen contraction. D. Encourage pushing with each contraction. Option B is the correct answer. Prepare for possible cesarean delivery. Bro presentation occurs when the fetal head is partially extended so that the bro, that means forehead, is the presenting part. This presentation creates the largest possible cephalic diameter, making vaginal delivery nearly impossible in most term pregnancies because the fetal head cannot safely pass through the maternal pelvis. Question number 10. The nurse notes variable decelerations on the fetal monitor in a breech presentation. What is the most likely cause and priority nursing action? Options: A. Cord compression, reposition the mother and administer oxygen. B. Uterine rupture, prepare for surgery. C. Maternal hypotension, elevate the legs. D. Fetal hypoxia, increase IV oxytocin. The answer is option A. Cord compression, reposition the mother and administer oxygen. The most likely cause of variable deceleration on the fetal monitor during a breech presentation is umbilical cord compression. In breech presentation, the umbilical cord can easily become compressed between the fetal body part and the maternal pelvis because the presenting part, that is the buttocks or feet, does not form as tight as seal against the cervix as the fetal head does in a vertex presentation. Question number 11. In a face presentation, what nursing assessment finding is most likely during vaginal examination? A. Palpation of the fontanelles. B. Palpation of the chin and mouth. C. Palpation of the occiput. D. Palpation of the sacrum. The correct answer is option B. Palpation of the chin and mouth. Question number 12. When the fetal spine is parallel to the maternal spine, this is known as options: A. Transverse lie. B. Oblique lie. C. Longitudinal lie. D. Breech presentation. And the correct answer is option C. Longitudinal lie. Question number 13. Which of the following best describes fetal engagement? Options: A. The fetal head is flexed with the chin on the chest. B. The biparietal diameter has passed through the pelvic inlet. C. The presenting part is at the level of the ischial spine, that is station 0. D. The fetal occiput is directed anteriorly. The correct answer is option C. The presenting part is at the level of the ischial spine, that is station 0. Engagement means the largest transverse diameter of the presenting part has entered the pelvic brim. Question number 14. A nurse palpates the maternal abdomen and notes the fetal head is at the iliac crest level, that is station -3. What does this indicate? Options: A. The fetus is fully engaged. B. The fetus is floating above the pelvic brim. C. The fetus is crowning. D. The fetal lie is transverse. The correct answer is option B. The fetus is floating above the pelvic brim. A high negative station, that is -3, means the head has not yet engaged in the pelvis. Engagement occurs only when the presenting part reaches station 0 at the level of the ischial spines, while crowning happens near +4 to +5 station when the head becomes visible at the perineum. Question number 15. The cardinal movements of the labor refers to options: A. The sequence of fetal heart rate changes during delivery. B. The series of positional changes the fetus undergoes during descent through the birth canal. C. The maternal postural changes during labor. D. The sequence of uterine contractions. Correct answer is option B. The series of positional changes the fetus undergo during descent through the birth canal. The 7 cardinal movements of labors are: engagement, the widest part of the fetal head enters the pelvic inlet of the mother. Descent, the fetal head moves downward into the pelvis. Flexion, the fetal chin tucks towards the chest to present the smallest diameter. Internal rotation, the fetal head rotates to align with the pelvic outlet. Extension, the head extends as it passes under the pubic arch. External rotation or restitution, the head realigns with the shoulder after delivery of the head. Expulsion, the shoulders and the rest of the body are delivered. Question number 16. During the extension phase of labor, which event occurs? Options: A. The fetal head flexes to pass through the pelvic inlet. B. The fetal head moves under the symphysis pubis and is delivered. C. The fetal shoulder rotates into the anteroposterior diameter. D. The fetal spine aligns with the maternal spine. Correct answer is option B. The fetal head moves under the symphysis pubis and is delivered. Question number 17. Cerebral perfusion pressure, that is CPP, is calculated using which of the following formulas? Options: A. CPP equals ICP minus MAP. B. CPP equals MAP minus ICP. C. CPP equals SBP minus DBP. D. CPP equals CVP minus ICP. And the correct answer is option B. CPP equals MAP minus ICP. Question number 18. The normal range of CPP in an adult is options: A. 20 to 40 mmHg. B. 40 to 60 mmHg. C. 60 to 100 mmHg. D. 100 to 120 mmHg. And the correct answer is option C. 60 to 100 mmHg. A typical adult CPP falls between 60 and 80 mmHg. Maintaining CPP at or above 60 mmHg is necessary to prevent cerebral ischemia. Question number 19. If a patient's MAP is 90 mmHg and ICP is 25 mmHg, what is the CPP? Options: A. 55 mmHg. B. 65 mmHg. C. 75 mmHg. D. 115 mmHg. The correct answer is option B. 65 mmHg. Question number 20. Which of the following situations would decrease CPP? Options: A. Increased mean arterial pressure. Option B. Decreased ICP. Option C. Increased ICP. Option D. Administration of vasopressor. Option C. Increased ICP is the correct answer, because as ICP rises, CPP decreases since CPP is equal to MAP minus ICP. Increased ICP would decrease CPP because it is abstracted from MAP.